Instructions. The listening test is 45 minutes. There are tasks in the two parts of the listening test. Each task consists of a recorded video or audio scenario. The number of questions for each task also varies depending on the length of the video or audio. There are multiple choice questions for some listening tasks and shift-to-shift report for others. After you have completed all the tasks in the listening section, you may have some time remaining. You can use this time to navigate back to previous tasks to check your answers. Now get ready for the test and follow the instructions. Part 1. Tasks 1 to 4 instructions. You will listen to a short audio or video recorded conversation and answer the questions. While listening, select the correct answer from the options provided for each question.
Task 1. Discussion for safety measures. You will watch a dialogue between a nurse and a nursing assistant in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello Isabella, how are you?
Hello, Mr. David. I am fine. Thanks for asking.
Today, I'm going to go through what you should do if you've been exposed to a patient's blood. I'll explain the first aid measures you should take and then we'll talk about how to report the injury.
Oh, yes. I'm really worried about getting a serious infection, if I look after patients who are very sick.
Yeah, I understand your concerns, but it's important to keep in mind the risk reduction measures I talked about earlier to avoid injuries.
You mean about using sharp spins properly?
Yes, and not resheathing needles after giving injections.
You mean not recapping needles?
That's right. After giving an injection, the syringe and needle should be disposed off in the sharps bin immediately.
Okay, but what if I accidentally have a sharps injury?
Yes, the first thing to remember is to follow the same procedure for all sharps injuries. This is because you may not know whether the source of the injury carries a risk of infection or not. If the blood is infected, you may not know the type of infection.
Okay.
First, wash the site of exposure with lots of soap and water without scrubbing the area.
Alright. Should I use antiseptic wash?
No, that's not recommended. Just liberal amounts of soap and water.
Should I try and squeeze out the blood?
No, don't squeeze out the blood or try to suck it out. Instead, allow some free bleeding of the wound. This means that you allow blood to flow out of the wound on its own.
Okay.
After you've cleaned the area, dry it and put on a waterproof dressing.
Okay. Will I need any treatment after the injury?
It depends on the level of risk. That's why you must report any needle stick injuries so that you have access to medical advice. If the level of risk is assessed as low, you may not need any treatment. If there is a risk of exposure to hepatitis B or C or HIV, post-exposure treatment may be needed. This might include vaccination against hepatitis B, taking antiviral drugs in the case of exposure to hepatitis C or PEP in the case of exposure to HIV.
Okay. So, the first action is to clean the area with lots of soap and water, encourage bleeding without squeezing the area, dry it, and cover it with a clean dressing. Then I report the injury, so the level of risk for infections like hepatitis B or C or HIV can be assessed.
That's correct. Also remember that prevention of needle stick injuries is equally important as the management of the injuries.
Okay, I will do the same. Thank you.
You will now have 45 seconds to review your answers.
Task 2. Patient injury. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Good morning. My name is Kate. I'm one of the registered nurses on duty today.
Good morning, nurse.
I see in your notes that you've come in with back pain. Is that right?
Yes. I've got terrible back pain. It's so sore.
I see. Can you tell me how you hurt your back?
Yes, sure.
Tell me how you hurt your back.
Yes, sure. I've got a little boy. He was crying in the next room, and I rushed to see why he was crying. I slipped over one of his toy cars.
Oh, that's a shame. Can you tell me where the pain is?
Well, it's mostly in my lower back. You know, right across my back.
The pain like?
It's really awful. It's so painful.
What type of pain is it? Is it a sharp pain or a dull ache, for example?
Oh, I see. It's a sharp pain. It's worse when I try to move.
Okay, how would you rate your pain, on a scale between 0 and 10? 0 is no pain, and 10 is the worst pain you've ever experienced.
Oh, I'm not sure. It's really bad, but I am not sure which number it is.
1 to 3 is mild pain. It's just a niggling pain that is a bit annoying.
Well, it's more than that.
4 to 6 is considered moderate pain. That's when the pain interferes with your daily activities. I mean when you can't concentrate on a book, or if you find it difficult to get dressed or have a wash. Pain that's worse than that is severe pain. That can be any number between 7 and 10.
I understand now. The pain is really bad. I would rate it as an 8.
Okay, I'll explain what will happen now. The emergency doctor will examine you first. You might have an X-ray. I'll get you some painkillers, and some anti-inflammatories as well.
I've already had some painkillers. I took some at home, but they didn't do anything.
We'll give you some slightly stronger ones as well as the anti-inflammatories.
Why do I need anti-inflammatory tablets? My skin isn't inflamed.
The anti-inflammatories are used to reduce the inflammation in the tissues around the painful area. That helps ease the discomfort.
So you're saying they work with the painkillers?
Yes, that's right. The other thing that may help the pain is to do some gentle exercise, to try to keep moving as much as possible. I'll get you a leaflet which explains what the exercises are like. The physio can help you too.
Okay, but I really need strong painkillers. Can I just have some extra strong painkillers now?
I understand that it is very difficult when you are in a lot of pain, but it's best to start with simple painkillers and anti-inflammatories. They work well together. If you find that the painkillers are not strong enough, you need to come back to A&E.
I don't know. That's going to be no help at all. I've got small kids at home. I have to be able to look after them. I just want the strong painkillers.
I know it's hard when you have children to look after, but it's not possible to start with the strongest painkillers. Would you be willing to try the medication for a day and see if it helps?
I suppose so. So, if the tablets are not strong enough, I can get different ones?
Yes, but it's important to start with the tablets we are giving you now. There are a few things I need to tell you about the medication. First, you should always take the tablets with food. That's to stop you feeling sick. Also, make sure you don't take more than the recommended dose. The maximum number of tablets per day is on the label on the box.
All right. I understand.
Take the tablets with food, and only as many as it says on the box.
That's right.
It would be very helpful if you did the exercises on the leaflet that I gave you. I also recommend you to use heat packs on your lower back to relieve the pain.
Okay. I'll try.
That's great. I'll get your medication for you before you go home.
You will now have 45 seconds to review your answers.
Task 3. Patient Status Report. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Hello, Mr. Thomas. I'm Noah, the respiratory nurse at the GP practice. Thanks for coming in to talk about your sleep apnea with me.
Hello, Noah. I'm very confused about this condition. I'm not at all sure what I have to do now.
That's okay, Mr. Thomas. I'll explain about sleep apnea and the treatment that you need to follow. I'll also talk with you about some lifestyle changes which may help you as well.
Okay, that would be very helpful.
Before I start, can you tell me what sort of health problems you've been having?
I had a car accident 6 months ago and injured my nose. Since then I've been snoring all night, according to my wife. All I know is that I wake up exhausted every morning.
I'll explain about sleep apnea and why it can be a problem if you don't manage the condition.
I thought it was the snoring that was the problem.
No, sleep apnea is different from snoring. Sleep apnea is caused by the closing for short times during sleep. This closes the upper airway, so breathing stops. After a short time, the brain realizes that breathing has stopped and triggers breathing again. This can sound like snoring.
So, you're saying that I stop breathing at night?
Yes, that's right. In most cases, the person suffering from sleep apnea doesn't even realize they are waking up and are surprised when they wake up exhausted.
I see. Now I understand why I have daytime sleepiness, and I just can't seem to concentrate on anything during the day.
The important thing to remember about the condition is that it is not simply a form of insomnia, a type of snoring. If it is not managed properly, it can be a serious condition. People with severe sleep apnea have an increased risk of car accidents and high blood pressure. They may also be more at risk of stroke and heart attack.
Oh, that sounds very serious.
I can see it's a bit of a shock for you and a lot to take in, but there are some things which will help you manage the condition.
Treatment? Like medication?
No, it doesn't involve medication. I'll explain a device you can use at night. And also talk about some lifestyle changes which can be very effective.
Right. The doctor mentioned something about a special mask. Is that correct?
That's right. It's called a CPAP mask. CPAP means continuous positive airways pressure. The mask looks a bit like an oxygen mask, but it works in a different way. It helps to increase pressure in your throat so that your airways do not collapse and cause you to stop breathing.
I hope I don't have to wear it all day.
You put the mask on in the same way as an ordinary oxygen mask. You only use it at night to make sure that you get a good night's sleep.
Okay, that seems easy enough. What about the lifestyle changes you mentioned?
Firstly, we advise you to avoid drinking alcohol or take medication which may make you sleepy.
I don't take any medication which makes me sleepy, but I do drink alcohol. Probably a bit too much, if I'm honest.
How would you feel about not drinking alcohol or limiting your intake to a small amount?
I can try to cut down, but I can't see myself giving it up altogether.
That's great that you are willing to consider. You might find it's easier to limit your alcohol intake gradually.
Is that the only lifestyle change I have to make?
There is another thing which can make sleep apnea worse. That's carrying excess weight. Have you noticed any change in your weight lately?
Yes. I started to pile on the weight after the accident. I couldn't move about a lot for quite some time, but honestly, if I use this machine at night and get some sleep, I should be okay during the day. I might have a bit more energy.
Yes, that's certainly true. However, excess weight, particularly in the neck area, also plays a big part in your ability to breathe well when you are lying down.
Well, I don't know. I've always had so much trouble losing weight. I think it would be too much for me to change all at once. I appreciate that it seems overwhelming, but it really is very important to take as much pressure off your throat area.
Remember that this is the area that is affected in sleep apnea. The CPAP machine is very effective, but you can make it easier for the machine and yourself losing even a small amount of weight.
You may be right, but I wouldn't know where to start with a diet.
Would you be willing to look through this leaflet on nutrition and weight loss? As I said before, sleep apnea can be a serious condition. It is very important that your condition is managed well to avoid complications.
Okay. I'll read the leaflet and make an effort to lose weight. As you say, weighing even a little bit less has a positive effect.
Yes, right.
You will now have 45 seconds to review your answers.
Task 4 Patient Status Report. You will watch a dialogue between a nurse and a patient in a video scenario. You will get 45 seconds to read the questions.
Listen to the recording and select your answers.
Good morning, Ms. Denver. My name is Garrick. I'm a dementia specialist nurse in the hospital. I'm going to go over the information your doctor gave you about your mother's condition. I know it was a lot for you to take in.
Yes, it was a lot to take in. The doctor said that she has vascular dementia. I didn't even know she has vascular dementia. I didn't even know there were different types of dementia, so I was quite confused about it.
Yeah, it can be confusing. The term dementia describes a set of symptoms that can include memory loss, difficulty with thinking processes, and communication problems. Alzheimer's disease is the most common form, followed by vascular dementia, the type of dementia your mother has.
Oh, is vascular dementia different then?
Yes, it is. Vascular dementia is caused by reduced blood supply to the brain, often because the blood vessels are diseased or blocked. The follow-on from this is that brain cells don't get enough oxygen to survive. This death of brain cells is what can cause problems with cognitive function or the ability to think clearly and reason through problems. That is certainly what's been happening.
She had a stroke a few months ago. The doctor said that may have caused the dementia.
That's right. Vascular dementia is sometimes called stroke-related dementia. Like your mother, can develop vascular dementia within 6 months of having a stroke.
Any condition which causes disruption to the blood flow to the brain adds to the risk of developing vascular dementia. I took Mum to the doctor when I noticed she was getting flustered about things which never used to bother her. She was always such an organized person and very clever too.
It was a good thing that you brought your mother in for an assessment. The early symptoms of vascular dementia usually relate to changes in the thinking processes. This includes the way a person organizes things or makes plans. Some people find they start to have difficulties making decisions as well.
Right. But, I thought memory loss was the first sign of dementia?
That's one of the differences between Alzheimer's disease and vascular dementia. People with Alzheimer's disease tend to have short-term memory loss as an early symptom, whereas people with vascular dementia tend to have more problems with thought processes. Despite this, people with vascular dementia can also have difficulty remembering recent events.
The doctor mentioned that she may have behavior changes. What did he mean?
Some people experience mood changes, such as apathy, depression or anxiety. It's quite common for people with vascular dementia to feel depressed, especially if they are aware of how the condition is affecting them. Sometimes they have rapid mood swings and may become tearful as well.
Yes, we have noticed this happening a bit lately. As I said before, Mum was a very competent person and ran her own business for many years. She is finding the diagnosis hard to accept. She was asking about her treatment options and couldn't remember what the doctor told.
I'll go through her treatment with you now. The first part of her treatment is to reduce risk of further strokes. She's taking blood pressure tablets and cholesterol-lowering medication already, which she will continue.
What about a tablet for the dementia? The father of a friend of mine has Alzheimer's disease and takes a tablet for it every day. Can't Mum take the tablet too?
Unfortunately, the tablet used to slow the progression of Alzheimer's disease doesn't help people with vascular dementia.
Is there anything else I can do to help my mother?
Yes, there are some things you can do to improve her quality of life. It will help if she follows a healthy diet and gets regular exercise. She should also moderate her intake of alcohol.
Okay, but what about her mental faculties? How can I help her remain as independent as possible?
There are a few strategies your mother can use to manage the cognitive symptoms of vascular dementia. Your mother will find that breaking complex tasks down into smaller steps will often make them easier. Also, if she stays in an environment which is not too noisy, it is often easier to concentrate. A regular routine is advisable as well. That would help her organize herself, wouldn't it?
Yes, that's right.
It's also important that your mother stays mentally active too. There are some activities which help with this, like writing a life story or making a memory book.
Oh, yes. I've heard about things like this. Someone suggested that Mum might get something out of a memory cafe.
That's a good idea. The last thing is about personality changes. As vascular dementia progresses, changes in behavior becomes more likely. It can be difficult to cope with, especially if a person's behavior changes dramatically. It's usually better not to use medication like sedatives. Talking therapy can be useful and support groups can help as well. I'm going to refer your mother to a community dementia nurse who will visit her and be a good point of contact for you as well.
Thank you so much, nurse. We need a lot of support as Mum's condition progresses.
Don't worry.
You will now have 45 seconds to review your answers.
Part 2. Tasks 5 instructions. Listen to the report and dialogue and circle the correct answers as you listen.
Task 5A, Shift-to-Shift Report. As you listen to the Shift-to-Shift Report, circle the best choice for each room and patient. You will get 45 seconds to read the questions on the chart before the audio begins.
Listen to the recording and select your answers.
This is the evening shift report for Monday, June 3rd. Room 408, Mr. Davies is admitted to the hospital with complaints of cough with mucus secretion for 2 weeks. Cough increases during the night and decreases with rest. Fever with temperature 100 degrees Fahrenheit since yesterday. He also complains about the headache yesterday, which also decreases with rest. Room 410, Mr. Williams, had undergone the surgery. After surgery, he was complaining about the inability to empty the bladder. We insert a catheter to drain the bladder until the patient regains bladder control. Trospium medicine is given to stimulate the bladder. Now, room 419, Mr. Taylor underwent bypass surgery. After surgery, he is feeling constipation. He is advised to take stool softener laxative. He is also advised to keep drinking normally. He is feeling depressed. Then room 423, Mr. Wilson, is improving day by day. Doctors are coming to meet the patient. He is going to discharge within 2 days. He is very happy about the recovery and is very cooperative with the staff. Also room 426, Mr. Evans, the patient complains of constant thirst and excessive passing of urine. Concerned doctor of the patient was informed. The doctor diagnosed the condition as diabetes insipidus and he also decided to measure one more hormone in patient's blood. So that test would be conducted today. Okay, room 428, Mr. Thomas, his condition is good now. He now gets enough sleep. His wound is healing now. The pain around the wound has almost gone. But he is still advised to continue the antibiotics for few more days. Room 439, Mr. Johnson, he was admitted yesterday with severe eczema. He has to undergo the wet wrapping treatment. The therapy would start from tomorrow. One of his family members is allowed to stay along with the patient. Okay then, I think that's all to report. For now, hope you have a good night. Talk to you later.
You will now have 45 seconds to review your answers.
Task 5B, Shift-to-Shift Report. Now, listen to the Shift-to-Shift Report again, and circle the best choice for each room and patient. This time, you will need to listen for different details.
Listen to the recording and select your answers.
This is the evening shift report for Monday, June 3rd. Room 408, Mr. Davies is admitted to the hospital with complaints of cough with mucus secretion for 2 weeks. Cough increases during the night and decreases with rest. Fever with temperature 100 degrees Fahrenheit since yesterday. He also complains about the headache yesterday, which also decreases with rest. Room 410, Mr. Williams, had undergone the surgery. After surgery, he was complaining about the inability to empty the bladder. We insert a catheter to drain the bladder until the patient regains bladder control. Trospium medicine is given to stimulate the bladder. Now, room 419, Mr. Taylor underwent bypass surgery. After surgery, he is feeling constipation. He is advised to take stool softener laxative. He is also advised to keep drinking normally. He is feeling depressed. Then room 423, Mr. Wilson, is improving day by day. Doctors are coming to meet the patient. He is going to discharge within 2 days. He is very happy about the recovery and is very cooperative with the staff. Also room 426, Mr. Evans, the patient complains of constant thirst and excessive passing of urine. Concerned doctor of the patient was informed. The doctor diagnosed the condition as diabetes insipidus, and he also decided to measure one more hormone in patient's blood. So that test would be conducted today. Okay, room 428, Mr. Thomas, his condition is good now. He now gets enough sleep. His wound is healing now. The pain around the wound has almost gone. But he is still advised to continue the antibiotics for few more days. Room 439, Mr. Johnson, he was admitted yesterday with severe eczema. He has to undergo the wet wrapping treatment. The therapy would start from tomorrow. One of his family members is allowed to stay along with the patient. Okay then, I think that's all to report. For now, hope you have a good night. Talk to you later.
You will now have 45 seconds to review your answers.